All right, I'm going to go ahead and get started, and some folks might come in later. We'll welcome them in. So first of all, Crystal, I'm Devin Quinn. I'm the policy director at the New Hampshire Women's Foundation. This is a presentation on our recent publication, The Status of Women. Also here we have Crystal. If you could wave hello. Crystal will be doing helping us out in the chat, and if you have any questions, put them in the chat, and Crystal will help me along. I'm going to share my screen in a second, but purposefully we made this a meeting rather than a presentation. So please you can introduce yourself. Please hop in with any questions in the chat, put them in, or if you feel like it, just unmute yourself to ask a question. We are going to record this for other legislators who couldn't come, who want to see the presentation, but we will stop recording at the end of the presentation if you want to discuss. And this is as much an opportunity to learn about the data and ask questions about it as it is to talk to each other. If you're all interested in this presentation, you might say, oh, well, this is interesting information and relates to this bill I'm sponsoring. If you all want to know about it, here it is. Use this and the chat any way you want to. So let me go ahead and get started. Okay. All righty. Welcome to those who just came in. All right, I'm going to present you on the status of women in New Hampshire. Again, I'm Devin Quinn, the Director of Policy at the New Hampshire Women's Foundation. Also online is Crystal Parody, who can answer any of your questions, technical or otherwise, in the chat. I'm going to quickly go over the Women's Foundation. I know some of you are very familiar with the Women's Foundation, others might not be. So I'm just going to quickly cover the Women's Foundation before I jump into the data. The New Hampshire Women's Foundation was founded in 2014, and it was when 5 organizations here on the side came together. And all of those organizations' missions and goals impacted who the Women's Foundation became. And you'll see that in our mission. The New Hampshire Women's Foundation invests in opportunity and equality for women and girls in New Hampshire through research, education, advocacy, grant making, and philanthropy. And those words there, research, education, advocacy, grant making, and philanthropy, are really the goals of the Women's Foundation and our areas of interest. This presentation is on our research, the status of women, but certainly we are not just a research organization. And you might interact with us in an advocacy perspective at the State House, of course, as well. But just to give you a sense that we are have multiple arms of work that we're working on. So as an example, our grant making program, these are our 2022 Women's Foundation grantees. I won't go through all of them, but they're wonderful organizations. You might know some of them in your area or around the state, but these are fabulous organizations that I love to learn about, doing great work. And we've also expanded our grant making this past year. In 2022, we opened the Women and Girls of Color Fund. And these are our grantees of this new fund on the side. But the fund, these 2 new funds augment our existing grant making to provide lower barrier, faster turnaround grants to projects led by and serving women and girls of color. Another grant that we started last year is the Reproductive and Sexual Healthcare Access Fund. And our Reproductive Freedom Fund was our first grantee of this fund. And that works to fund organizations and initiatives advancing reproductive justice specifically. Certainly, we do legislative advocacy. Here's an example of the bills we got involved in last year, but they span abortion, girls' mental health, prenatal care, and data collection on women, specifically for efforts like this, like the status of women. We also run a Women Run program, and it is the only nonpartisan program in the state to encourage and train women to run for office at the state and local levels. And so if you are encouraging other women to run, please send them our way. We would love to grow the number of women in the State House. And of course, we have other events and programming. I'll just shout out our annual gala event, which is in the spring, and that's a formal and very fun event. And the fall, we have the annual Women Building Community Luncheon, and that's in Manchester, and a big gathering of over 500 people usually. We do other events and programming as well. So if you want to learn about all of our programming, all of these things, we send out a new weekly newsletter, which is a fun way to get all of our information. You can sign up for that at our homepage or at that address, New Hampshire, nhwomen'sfoundation.org/engage. And finally, the other aspect of the work we do is in research. And so our research program focuses on the right. You see the status of girls and the status of women. These are our flagship publications. They come out annually every other year. So last year we put out the status of girls, and this year we're putting out the status of women, and we'll continue like that every other year. And on the left, you see our Gender Matters publications. Those are quarterly publications, and those are fact sheet, usually 2 sides fact sheet. We do a fact sheet on the primary results, the general election results. You're also seeing a Gender Matters on abortion and a Gender Matters on judicial representation as well. So this is kind of our research program, but we're going to focus on the status of women in 2023. So let me first, Tana Clues could not be here today, so I'm going to play a little video of her introducing this to us all.
Hi, I'm Tana Clues, CEO of the New Hampshire Women's Foundation. I'm thrilled to share with you our latest edition of our flagship publication, The Status of Women in New Hampshire. This report is the most comprehensive compilation of data on women in the Granite State. It includes 85 indicators of women's well-being in the areas of health, safety, economic security, and leadership. Our data shows that women in New Hampshire are hardworking, resilient, and diversifying. But the report also highlights many social, economic, and political barriers facing women and compounding inequities by race, ethnicity, geography, age, and parenting status. These barriers and inequities present opportunities for New Hampshire to invest in women for a more vibrant and prosperous future. What's unique about our research here at the Women's Foundation is our gender lens. We know how vital data-driven research is to gender equality. The New Hampshire Women's Foundation believes accurate and comprehensive data must be the cause that will most impact Granite State women and girls. In addition, we know that education, policy, community, business, and nonprofit leaders need accurate data to understand the changing demographics of their constituents and the challenges and opportunities that persist for women, girls, and marginalized genders in New Hampshire. For these reasons and more, the Women's Foundation is committed to being a trusted source of data-driven research on women and girls. The Status of Women and its sister publication, The Status of Girls in New Hampshire, are released consecutively every other year to provide consistent data and insight on women and girls in our state. You can read this report and others, and download a copy by visiting nhwomen'sfoundation.org. Thank you.
Great. So I know a few more people just joined us. So I want to just remind you that I'm Devin Quinn. This is the Women's Foundation presentation to just legislators on the status of women, our flagship report. This is in meeting mode, so I just want to remind folks to mute yourself when you don't want to speak, but do feel free to unmute yourself if you want to ask a question at any point in time during this presentation. You can also put your question in the chat, and I'll make sure that Crystal interrupts me to ask that question from the chat. We are recording this presentation, so we can send it to other legislators who ask for it, who weren't able to be here, but we'll stop recording at the end if you want to discuss. And we also want to encourage you to use the chat function to talk to each other about these things. This is a data presentation. We certainly do advocacy, and you will hear about our efforts and lobbying efforts at the State House on things that impact women and girls in New Hampshire. But this really is a data presentation. We're not here necessarily to advocate or lobby, though sometimes the data may feel self-evident in that way to support women and girls in certain areas. But this is a data presentation. And so we want you to be able to have the data and tools to impact the legislation and the policy that you are seeking this session. So if something is calling out to you, feel free to put it in the chat as a statement of saying, this is exactly why, this data is exactly why I am supporting this legislation or sponsoring this. Please join me. So please feel free to use the chat as a way to talk to other folks here as well. So a couple of things about the data that's important to keep in mind. Our research methods are oftentimes we are collecting information from national or federal sources. Think the census. We also collect at the state level from different departments at the state, local whenever we can, and a few pieces of information that truly are not collected anywhere else. We will do our best to collect data, unique data that you won't see anywhere else, but we aren't an academic research university, so that is limited. So I say that because the data that you see is going to be from other sources. And so that does limit us to what that data and how it was collected. So oftentimes we don't have survey collections ask gender in a binary. And so they'll ask male or female. And so unfortunately, when we present that data to you, that's how we are limited in that data. Or race, ethnicity, or other things are really defined by each individual data collection process, which is why we carefully cite everything in this report. And if you want to know, you can really just ask me and I can tell you off the top of my head, but it's also all in the report as well, where you could look up exactly what that data source means. I also want to mention our design. We try not to put out, white papers that are dense and heavy and hard to access. We want this data to be as accessible as possible, where a girl in the 7th grade could open this up and learn a lot about her state, but it's also accessible to adults, community members, legislators like yourselves, to make sure that it's as easy as possible to get that quick data. And if there is data in here that isn't meeting your needs, if you need additional data with a gender lens for anything you're working on, just email me, text me, call me. I'd love to find out and help you find that information whenever we can. So jumping into the status of women, the outline of it is that we have 85 indicators. We'll go through a lot of them, but not all 85 today. We break it down into 6 sections: in demographics, COVID-19 this year, health, safety, economic security, and leadership. And we also put in organization or spotlights in between these sections to break up that data, because we believe that as important as data is, it's also so important to recognize the real people that this data represents and the real organizations on the ground doing work in these areas that have done so much for our state, and to recognize them. Often they're our grantees, and recognize the work that they're doing in these areas. So let me start with demographics. New Hampshire has 1.4 million people, half of whom are women. The high school diploma rate is very similar among men and women, 95 and 94%. For associate's degrees, closer, but a little different. Women have 52% and men at 48%. But in the labor force, we see a difference in that women are 64% in the labor force and men are 73%. So we're starting to see that difference in the labor force. Race and ethnicity. The race and ethnicity of women in New Hampshire is 90% white. This is from the most recent census. The last census 10 years ago had a higher percentage of white. So we are in fact diversifying, which is a good thing, but we remain less diverse than most other states. Gender identity and sexual orientation. This is one of the few places that we can really break down gender identity. The Pulse survey was able to ask about gender identity. Most other surveys, we don't have that information, so I'm excited to bring that to you. In New Hampshire, people who identify as cis female or cisgender female are 51.3%, cis male 46.5%, trans female 0.4%, trans male 0.4%, and none of these 1.4%. Sexual orientation, we have 89 and 91% men and women are straight, 7% of women are bisexual, 3% of men are bisexual, 2% of women lesbian, 3% gay, 2% of men and women are something else, and 1% are not sure. I'm going to move into COVID-19, unless, Crystal, there are any questions in the chat.
None at this time.
Okay. So for COVID-19, we have COVID-19 deaths, cases, and vaccinations. So we do see that there were slightly more as a percentage men than women. And I should say that across this presentation, you'll often see that when we look at a breakdown by men and women, it'll be women in blue and red, men in red. So 46% versus 54% of COVID deaths. Cases was slightly more cases among women, but we do have this 2% where we're uncertain by gender. And but vaccinations, we saw that women had a higher percent of vaccinations. And specifically, when we think about COVID data with a gender lens, we think about the unemployment claims that skyrocketed at the early stage of COVID. The pink outline is when we had a state of emergency in effect in New Hampshire. And you can see that before the state of emergency was called, unemployment claims for women were around 36 or 37% women, but then they skyrocketed really into be much more than the majority of unemployment claims were women after that state of emergency for COVID. I'm gonna move on to the health section now. So let's talk about health insurance first. And this might be important for this session particularly. So the uninsured, women's percentage of uninsured has really come down over the last 12 years or so. In 2010, 12% of women were uninsured, and now we're down to 5%. Certainly 5% is low. That is it's also low for men and women, for all people in New Hampshire, but particularly for women, it's really come down. And the programs that we had to create to address the uninsured really impacted women in a positive way. When we specifically look at Medicaid, of New Hampshire women, 12% of New Hampshire women are enrolled in Medicaid. 7% of New Hampshire men are enrolled in Medicaid. So when we think about our Medicaid population, that is more women than men. And when we look geographically in our New England neck of the woods here, this is percentages of women. So percent of women by state enrolled in Medicaid vary from 18 to 22% among other states. So we're looking around 20%, which is much higher than New Hampshire. New Hampshire actually has a very lower percentage of people, and particularly women, enrolled in Medicaid, though it's higher for women in New Hampshire.
Devin, I'm just going to interrupt you. We had a question in the chat from Nick. How do the most recent findings on women in the workforce compare to previous findings? What is the trend?
So we'll have a little bit more in economic security, but certainly you've probably heard that women have left the workforce and are rejoining the workforce since the beginning of COVID, certainly. But there are a lot of barriers in their way, and certainly in childcare, and that has a big impact on that. And I do have some slides later on childcare. But if I miss the point of your question, you want to clarify, let me know and I can answer more to that. Okay, let me follow up with me if you want some more information, or if I didn't answer the question. To move along with health insurance, when we talk about our health insurance rate or our coverage rate, it's really good. We have 5% uninsured. That's great, but let's break that down more by race, ethnicity, and gender. So on the far right, you'll see that 94% of women in New Hampshire have health insurance. But when we break that down by race and ethnicity, we see that 95% of white women are insured, but Black and African American women is only at 81%. So we really need to make sure that the good news of our uninsured rate doesn't prevent us from looking at the disparities within that uninsured group.
Devin, one more question. What accounts for the difference in enrollment for Medicaid? Are women more likely to sign up, have more access, find Medicaid to be more important? That's from Representative Kate Murray.
That's a great question. I think you'll find that more women qualify, and we'll talk about women's poverty later and the disparities among gender in poverty. And so certainly enrollment will definitely matter. I think there's something to be said for awareness, like you said, or being aware of Medicaid or having a positive relationship to it. I think oftentimes children who have a higher income threshold to qualify for Medicaid. So if there are single women or women who are responsible in their household to enroll their children in Medicaid programs, then they're more likely to be aware of it and think positively of it. Or also if they're the single household, head of household in a single household, then they might know about it because of their children. So a lot of these different factors might be impacting that. So oral health, I'm excited. This is a new indicator, and I'm excited to present this one. And it's also some positive news. This is just private health insurance claims. We won't have data yet on dental and Medicaid. But women represent 55 and 54% of all claims for preventive and restorative oral health care claims, which is good. Women are going to the dentist, they're getting the oral health care that they need. They're taking care of their mouth and their teeth. In mental health, we have some disparities by gender here. Women, 66% of women experience anxiety compared to 48% of men. And depression, that ratio comparison is even greater, and almost twice the rate of women compared to men experience depression. So when we think about mental health, we certainly need to look at disparities there too. Going to substance use. This is a graph by men and women and over time of substance use overdose deaths. And each number represents an individual who lost their life to the opioid crisis or to an overdose. And certainly men we have a greater number of men who have lost than women each year. And that did peak in 2016, 2017, 2018, has come down a little bit. But it is important to talk about who we are losing to overdose deaths. And certainly that is men, but it is also women. So to make sure that we're challenging that picture in our mind of who we mean by the opioid crisis and overdose deaths. Incarcerated women. So certainly there are more men in the New Hampshire prison population than women. But as a percentage of those folks who are in prison, women have a much higher percent of people who are incarcerated for drug and alcohol-related offenses. So twice the percentage of people who are incarcerated for drugs and alcohol-related offenses are women in the women's prison compared to the men's prison. So when we talk about alcohol and substance use, and we talk about the prison population, who is there for what reasons as a ratio or percentage is important to keep in mind. For reproductive and sexual health, the percentage of those who received inadequate prenatal care. On the bottom here, you can see the national compared to New Hampshire rate, and New Hampshire is much lower than the national rate for inadequate prenatal care, which is great. But it's so important for us to look at the disparities within that and see that 18% of Black or African-American women received inadequate prenatal care. And inadequate may mean they received no prenatal care or they didn't receive as many visits as it would to be adequate prenatal care. Also in sexual health, the chlamydia rate by gender. And this is true across the board nationally. New Hampshire isn't unique in this way. But the sexually transmitted infection of chlamydia impacts women more than men. And so of the chlamydia cases in New Hampshire, 57% are women. This was a really great study that came out in 2020, and it tracked the impact of rural labor and delivery closures between 2000 and 2020. So this is just labor and delivery units in rural areas, and it goes only up until 2020. I'm sorry, 2018. It was released in 2020, but it goes up to 2018. So there might be more and of this tracking. So I'm excited to see how this data comes out later. But it shows the huge impact of in 2000, when we had 26 labor and delivery units. By 2018, that dropped to 17. rural labor and delivery units. And the impact of that on the right, you'll see, is that in 2000, the average minutes to the closest labor and delivery unit was 18 for rural folks, but that increased to 39 minutes by 2018 with those closures. And this is an average. So certainly half of folks have a shorter travel time and half have more than 39 minutes. And abortion access. In this case, we wanted to show a regional comparison. So I think a lot of times we see a map of abortion access in the country, and the South, we have a lot of red. In the Midwest, we have a lot of red, and New England, maybe green, to show in this on the right-hand side, this key over here from supportive to hostile laws. But there's more nuance to that. Abortion is legal up to 24 weeks, and then there are exceptions after 24 weeks. However, there are a lot of different policies that can make it harder or easier to access abortion. And so comparing us to our region gives us a little bit more of that nuance. And most importantly, New Hampshire is the only state in New England that does not have a state law that protects the right to abortion. We stand alone in our New England neighbors in that. So here's the first time we get to a spotlight, and the health section is the longest, so we didn't get here as quickly. But I didn't include the written portion of this. But here's a lovely picture that we have in our Status of Women document to keep in mind of all the people who are working to expand access to abortion, including the folks of our grantees, our direct care providers, folks who are funding abortions, and the activism we saw this past year on abortion, to keep that human aspect of both patients and providers and people of all generations working on this issue. Now we're moving into the safety section. And this is mostly in domestic and sexual violence. And this data comes from our friends at the Coalition for Domestic and Sexual Violence. So here we're looking at their data. So this isn't all cases of domestic and sexual violence. This is of those who use domestic and sexual violence resources in their communities. So certainly we want to acknowledge that people of all genders can be survivors of domestic and sexual violence, but certainly the overwhelming percentage of people impacted are women. When we look at hotline calls that crisis centers received, when we compare before COVID to the start of COVID, we see a 15% increase in calls. And you might have heard that anecdotally or in newspaper articles, but that is certainly the data here to show that. And in shelters, so this is specifically domestic and sexual violence shelters, they had a 16% increase in the number of individuals who were provided shelter between 2020 and 2021. And also, they saw a huge increase in the number of nights stayed per person. And certainly that is a complex story there. So certainly COVID had a huge impact on that, the increase of domestic and sexual violence, but also the housing crisis as well. Not being able to transition to other housing definitely impacted the number of nights stayed. And certainly you can imagine that the number of nights stayed per individual or family impacted the number of people who could find shelter at all. And so all of these things really compounded in the last few years. So concluding this safety section, we wanted to highlight WISE, which is a wonderful domestic and sexual violence crisis center that has really expanded services to meet their community needs. And during COVID, they did a lot of expansion into online and chat-based survivor services that was helpful, not just in COVID. As you can imagine, a lot more people were home. And so maybe using the phone call or the hotline wasn't the best service that they could use. And so chat was probably better. It also really impacted and helped younger people who are more likely and more comfortable reaching out via chat or text message. So we wanted to highlight and lift up the work that is really being done in this area. And now I'm moving on to economic security. And I feel like a lot of questions that have come in so far do touch on economic security issues. So please bring them back up if you aren't seeing that connection as clearly, or you want other data or a different aspect to answer that question. So first, I want to talk about poverty by geography. So this map is showing both poverty by county and over time. So first, let's look at the top on Coos County, and the orange is the most recent poverty percentage. So Coos County has 11% of women in poverty. But if we compare that down the right at the end of that list to Rockingham, they're at 5%. So we see twice the amount of women's poverty in Coos County than we do in Rockingham. So we're seeing definitely geographic disparities in women's poverty. When we look at the pink compared to the orange numbers, this is a comparison over time. So this is 2012 to 2016 in purple, and 2016 to 2020, or the more recent number, in orange. You'll see that all counties actually reduced their poverty level, except with the exception of Sullivan. So we're seeing poverty go in the right direction, but there is still disparity by county. And certainly New Hampshire has a low poverty rate and a low women's poverty rate, but that's not the whole story. And we need to make sure we're talking about the disparities within women's poverty. All the way on the right, the most recent percentage of white women in poverty is 7%. And if we compare that to the most recent for Black or African-American women at 18%, that is a huge difference. Similar to what we saw by county, over time, you'll see that almost all of these race ethnicity groups are reducing the percentage of women in poverty, with the exception of Black and African-American women. There was a small increase in poverty there. So that might lead to questions of who are benefiting from more recent programmings. How do we track and identify, acknowledge women in the workforce and how their poverty is shifting, maybe due to COVID or other things? So this is bringing up some questions related to the race and ethnic disparities of poverty. When we look at poverty rates by age, we see that there is disparity by age. So when we look to the far left, women are in blue, men are in red. The far left, those are younger women. And we see that women have 10% of women in this age bracket are in poverty versus 6% of men. I'd point out that between 18 and 44, these are reproductive ages. And so how is that poverty disparate because of reproductive impacts of the workforce? So we're getting into how that economics works as well. By the time that women and men are reaching around retirement age, around 65, we start to get to a similar place of lower women's poverty, but then that shoots back up again among older women. And that's many different reasons for that. And that might be Social Security or pensions based on women's wages and earnings over her lifetime. Also an impact of living longer than male partners. And so we are seeing really the ends of the age spectrum are really the highest or more likely for women to see poverty. When we look at the data among unhoused and homeless populations, and now if we look at the greenhouse, well, I should say that there's two different sets of data here when we look at unhoused populations. So the house represents the data that we have of folks seeking emergency housing services at shelters. And the clipboards represent those who are not seeking services at shelters. And that is data through street outreach services. So that's different types of data, and there might be some overlap in that, but that's a different way to collect that data. So on the homes, we see that the total percentage of women who are seeking emergency housing services is 36% women. So a majority of men are seeking emergency housing services. And we see that both for in shelters and in street outreach, that it's a higher percentage of men. But when we look at individuals with children, that is a much higher percent of women. So as individuals, there are more men But women who are unhoused, or people who are unhoused with children, that is a much higher percent women. So it's important to think about not just total numbers, but really when we break down by different situation or family dynamic or family structure, how those services and needs might present differently. And let's talk about childcare. So the first graph we have here is in affordability. So these pink Legos represent a single mother's median income, and the orange Lego represents a married couple's median income. So if we look at the cost of the median cost of infant care, it would take up 11% of the median married couple's income and 55% the median income of a single mother's earnings. So when we talk about getting women back into the workforce, who left the workforce, who's trying to come back into the workforce, certainly childcare is a huge aspect of that. And the affordability of childcare is a huge part of that. How could a single mother afford to work and put their children in daycare or childcare or early learning, especially if they have more than one child? That is to say that 11% of a married couple's median income is also huge and also unaffordable. But truly, who is impacted the most by the issue of affordability? Would see that disparity among single mothers particularly. You saw this graph already, and I think we had some questions from this already. We brought it up as a graph from COVID, but it's also a graph as relates to childcare, right? So of course we saw that when children had to leave school or childcare, the majority of people who were impacted the most by that were women. Women were more likely to cut hours or leave the workforce entirely because of their children's school or childcare being impacted. So we combine that with the affordability issue, and that would really be a large part of that conversation of bringing women back into the workforce. And I also don't want to forget about grandparents. There's a lot of grandparents who step up to be responsible for their grandchildren. But when we look at who specifically are those grandparents, they're majority grandmothers. And so we also look at that in terms of median income of older women or poverty of older women, and who's taking care of grandkids. So I'm going to move on to the gender wage gap. The New Hampshire Women's Foundation always tracks the gender wage gap. This is a really important issue for us, and it touches so many other issues. So women in New Hampshire earn 76 cents on every dollar that a man earns. But that is different when we break that down by race and ethnicity. So specifically for this graph, we are comparing to white men. And when we compare white men to white women are earning 80 cents on the dollar, but Black or African-American women and Hispanic or Latino women are earning 63 cents on every white man's dollar. When we look at the gender wage gap by parenthood status, and this is comparing to all men, not specifically white men, but all men, the median income for men or wages for men. Women without children in the household earn 80 cents on the dollar, but women with children in the household earn 67 cents on the dollar. So in this economic security section, we conclude with highlighting Belknap House. And there are so many organizations supporting women and families and children and individuals with housing needs. And the Belknap House does a really wonderful job of also providing economic security programming to try to transition not just in housing, but also self-sufficiency in order to meet their goals for themselves and their families. And they do a wonderful job with that. This is our final section in leadership. So we'll start with legislative representation. And this was, we collected this data before this most recent election. So this is a comparison of last session, but it does actually follow some trends. So you'll see that New Hampshire is in light blue. And compared to other Senate, state Senate and regionally in New England, we do have a higher percent than most others. But that's not the case in the House of Representatives, interestingly. And I do have, of course, the updated data for New Hampshire, but not other states. And that trend is similar this year as well. So here you have the party and gender breakdown of folks in both the House and the Senate. The Senate reached parity this year. We're very excited about 50% of New Hampshire senators are women. Parity has happened once before in 2008 when there were 13 women senators. Now there are 12. And in the state House, we have 37% women. And we're always trying to encourage more women to run for office. So you are all the best people to tell this data to encourage more women to run for office and send them to our Women Run program. So women in the judiciary, we see so this is state courts at the state level, not at the federal level. When we look at our state courts, we have a total of 38% women judges, and that actually decreases as you increase the level of the court. So we have 43% women at circuit court, but 20% of women at Supreme Court level. And also when we look at race and ethnicity of our judges, this represents every single judge that we have in New Hampshire. And we have one person of color, and that is the only woman of color in all of our judges in New Hampshire. When we look at women in the top executive roles in private companies in New Hampshire, it depends on how large the company is, whether they're in the group of 250 more employers or 1,000 or more employees, but it's roughly a quarter of leadership are women among our large employers. And this is our last data point, is our paid leave policy. So again, we're looking at regionally the New England area. We have, when we look at either family, medical, or sick leave, any combination of those, or earned time off policies, New Hampshire is quite different. And of course, we do have the opt-in MetLife program coming, and that's actually happening right now, enrollment in December and January. But certainly as a benefit program, the way that every other state that does have a paid leave policy, it is quite different and different regionally as well. So we wanted to point that out. And then we end with the impact of our Women Run program over the last 5 years. This was our July training, day-long training with all these fabulous women who came out to join us, and we're excited to keep growing. And generally, let's talk about the takeaways. So on the left, we have opportunities to celebrate. It's a lot. Usually this data is full of inequities and barriers, but we always want to pay attention to the opportunities to celebrate too. Health insurance coverage, that is a huge thing to celebrate. Oral health care, COVID-19 vaccination rates, and fewer substance use treatment admissions and overdose deaths are all things to celebrate in terms of women's data. The takeaways in terms of inequities and barriers are across the board in all of these areas, in mental health and labor and delivery units, homelessness, childcare, prenatal health, access to abortion, domestic and sexual violence, poverty, wage gap, and political representation. We're seeing disparities across all of these indicators. But generally, we sum it up in this, in these two sentences. The data highlight a hardworking, resilient, and diversifying population of women. However, the data also enumerate many social, economic, and political barriers facing women and compounding inequities by race, ethnicity, geography, age, and parenting status. These barriers and inequities present opportunities for New Hampshire to invest in women for a more vibrant and prosperous future. So with that, I'm going to stop sharing my screen. And I'm going to leave it up to you if you have questions or you want to chat with each other in the chat. Please ask questions. Please stick with us until 1 o'clock if you can. If you need to go, that's fine. and know that we want to be your a reputable place for you to get the data you need. You have very busy lives. You are doing a lot on committees and in voting. And if there's a piece of data that you want a gender lens on, just ask me and I'll let you know if that exists in the first place, and how we can break it down otherwise. And I can get that data for you, and I'm happy to do that so you don't have to do that with all the other things you're juggling. And I hope you can use our resources to your benefit.